Okay, anyway, I'm sorry, finish your thought.
Oh, just that, even for the 85% of people who do have insurance, this is a confusing process. A lot of them don't realize that they don't have to go to healthcare.gov, especially if they're not eligible for the subsidy. And in fact, if a block of those people would get out of the website, it could free up some space on that website and maybe reduce some of the glitches for the people who really do need it. So I think that's one thing. I think people who don't need to worry about this at all because they have employer coverage or they have an existing plan that they can keep for a while that may not renew until sometime later in the year. This doesn't have to be a race to December 23rd for them. They do have some time, and I think it's important for them to be thoughtful about the decision that they're making.
Can you just real quick, because you're the expert on this, can you just kind of briefly explain why some people had their policies canceled? What's the philosophical reason why those policies were no longer worthy?
All right, well, there's two different issues. There's people who had their policies canceled because they were in the Missouri high risk pool and it just got shut down, or they were with Aetna and Aetna just terminated all of its policies 12/31 in Missouri because they bought Coventry and they were deciding that they were going to do their individual policies through Coventry and they weren't going to sell through Aetna anymore.
So do we have more canceled in Missouri than other places?
No, not necessarily for those reasons, but there's a whole other side of this. I lost it and my plan was canceled. Okay, so the other part of it is this. Every single not grandfathered plan, okay, every single plan that was written on, March 24th, 2010 or later, or changed that's non-grandfather, all those plans have to go away because they're not compliant with the metallic levels. They're not compliant with the new benefit requirements.
With the quality of coverage.
Right. So if you had an individual policy that was non-grandfathered, you can't keep what you have.
And why? Why was that bad for this system? Why? Tara, help us out, or anybody else.
So I think the main point is that the law tried to regulate what's called insurance. So the main thing they did around that was what was just mentioned about essential benefits. So they defined in the law what an insurance plan should include and what is essential for it to include. And if a plan didn't include those, it was not grandfathered in, as was just discussed. And so you may have had something that was called insurance, but it's not currently regulated to be qualified. And then so you have to switch plans. That's essentially what happened.
But then people got really mad because Obama had said, if you like your plan, you can keep it, which was, he misspoke. And so when everyone started getting angry, and there's already a lot of crap that's been thrown at Obama this past year, he decided to ask them to extend it for another year. So a lot of people got those, what was canceled plans, got them extended for at least another year.
I don't know that he totally misspoke, actually, in that I think one of the big problems with this law and its implementation is that so few people involved in it really understood the insurance industry and how it worked. Mm-hmm. I don't think they really fully understood the ramifications of some of the changes that were in the law.
We'll have to see. We'll find out from the history books why he said what he did. I've heard actually that it was probably a political decision. I think that the policy people, like the health economists, like people that I know, told him, don't say that.
People can't understand the nuance
of
it?
Well, he could have said something like, most of you will keep your plans, or if you have a, they were
trying to tighten up the language a little bit.
The political types came in and said, don't say that, because you're going to get rammed and you're going to get nailed. And frankly, I think that's what happened. And, so the thing to keep, and it gets back to the helicopter level, that we need to keep track of the 85% or so, the people who already have coverage. So if you have a stable employer and you've been in your insurance for a while, it's probably not going to change. Mm-hmm. And you don't need to worry very much about this. And so what we're talking about with these people who've had to change plans is a fairly narrow part of the population. These people matter, and it's not inconsequential to them. But remember, the other thing about our insurance market is they've been complicated for a long time. And, I've had my insurance plan changed probably 12 times in my life. And, my employer says, oh, you're in United Healthcare now, you're in, Aetna now, it changes. And people have had to deal with this, even if I've been covered my entire life. So, and you deal with changing your doctors, changing your networks, changing your plans. And, that's not to belittle these problems, but it's been a rocky place for a long time.
I kind of want to move on to something, we got a lot of other, but were some of those people, they were healthy and they had such little coverage that we were just not getting enough money out of them for the system.
Some of them entirely, that's true. I think there's young males probably that bought pretty cheap plans, but some of them couldn't have afforded much.
And we need them to pay a bigger share and not use the doctor.
The tough part is those people who had
No?
That-
No? I'm not right? I'm asking.
No, I agree. I'm just referring to myself as a young male.
Oh, sorry.
Yeah, that's how an insurance pool works. You
Yeah.
need to get people to pay, and the truth of the matter is, I think we all knew this, those who were doing research on it, there were going to be people who are going to be losers. And that happens when you change policy.
And I would argue that people would be shocked if they knew how little was actually covered in some of those plans that they had bought. And if they had an emergency.
The people who own the plans.
The people who own the plans, if they showed up.
I disagree, because most of the individual policies in Missouri covered almost every essential health benefit that they required. I mean, the Anthem Blue Cross, and that they are the 2,000-pound gorilla for individual medical policies in Missouri, right? Those Anthem Blue Cross and Blue Shield plans, they had unlimited lifetime limits already. They didn't have annual dollar limits on most benefits already. They covered hospitalizations and prescriptions and doctor's office visits, the emergency room, urgent care, all of those things. The big thing that they didn't cover really was maternity. Now, that was an issue, and there were certainly a lot of women who were falling into that gap of not being able to get a policy with maternity, so that was a problem. But the rest of the essential health benefits, most of those individual insurance plans really did cover all those things from before.
Well, people in the pre-existing condition pool, they didn't get, I mean, their coverage was either really expensive or they were turned away, though. So, I mean, you really
Right.
can't ignore that.
Oh, no, absolutely not. If you could qualify for it, you could get great inexpensive coverage. But if you couldn't qualify for it and you had to go in the high-risk pool, that was a big problem because those plans weren't the same and they were very expensive.
And if you could even afford the high-risk pool, because a lot of people didn't even turn
Can't.
to it.
And, so, and just to be clear, this is easier than if we'd have gone to a universal single-payer health care system?
You know, it's, you know, universal coverage through the government is probably the easiest way to do it, but, you know, could we have got that accomplished in this country? I frankly don't think so. Yeah, that's a whole nother show, so.
I think that's a whole nother year of
probably-
shows.
Probably one of the easiest things to
Starting with
do,
some sort
yeah,
of like
so.
McCarthy test of our, our loyalties. I don't know.
It would have been easy, but libertarians don't like it. And,
Yeah,
you
no,
know,
a lot of
so
people don't. A lot of
that's-
people, I don't think you would stop a libertarian. I think
You
a
know,
lot of people would.
Again, I think there's a lot of understanding and health literacy and all of those things involved in that. So again, a whole other show.